You miss your period. You've checked your period tracking app again and again. It keeps showing as delayed. You've taken a pregnancy test also. That also shows up negative. You wait a few more days, but your period is still not there. Is this normal? So, hello everyone, I'm Dr. Anjali Kumar, and I once again bring greetings to you from Maitri. Maitri is a space where we talk anything and everything about women's health. So, before we get into the reasons, it's important to understand that your menstrual period is controlled by a complex hormonal system called the hypothalamic, pituitary, and ovarian axis. Now, it's a wonderful communication loop between your brain, your ovaries, and your hormones. So, the hypothalamus in the brain releases some hormones which act on the pituitary, which is also in the brain, which then produces some more hormones which act on the ovaries to induce ovulation, which then produce estrogen and progesterone, which then act on the uterus to finally cause periods. So if your ovulation gets delayed, your period automatically gets delayed. So delayed periods mean delayed ovulation or no ovulation, provided you have ruled out pregnancy. Is it normal to have late periods sometimes? Yes, occasionally it is perfectly normal. Remember, your cycle is highly sensitive to changes in your body and environment. A delay of roughly 5 to 7 days here and there can happen without any serious underlying reasons. But definitely visit a doctor if your periods are getting delayed frequently, if the flow of your periods is also becoming scanty, if you have symptoms like acne, hair fall, weight gain, facial hair, and if you have difficulty conceiving a pregnancy. And just to remind you in between, in case you not yet subscribed to Maitri, do it right way. Most common medical reasons for delayed periods. Obviously, number one, exclude pregnancy in case you are sexually active. Now let's look at the rest of the reasons. The first thing is stress. Stress is one of the most underestimated and most common reason for missing periods. Remember, when your body is under stress, emotional, physical, mental, it actually shuts down this entire HPO axis. This disrupts the hormonal release and can delay or make the ovulation absent. So even if everything else is fine, stress alone can shift your cycle. Second, sudden weight changes. Your body fat plays a role in the estrogen production. Sudden weight loss, sudden weight gain, all these can disrupt the hormonal balance and delay your periods. Recently, now the use of GLP drugs like Ozempic, Mounjaro for weight loss can also toss the cycles sometimes. Eating disorders, anorexia and bulimia. Anorexia means that you're not eating. Bulimia, you're eating more. They also can be significant reasons for missing periods. And sleep disturbances or long travels or across time zone travels. Remember, your body follows a proper circadian rhythm, which is your internal body clock. So late nights, irregular sleep schedules, travel, especially across time zones, they all can affect your hormonal timing and can delay your periods. Breastfeeding. Now, irregular ovulation or anovulation is very common during breastfeeding because of an elevated hormone called prolactin. That's why missing periods or absent periods during breastfeeding is very, very common. Then, very important, PCOS. So I always tell everyone at Maitri, PCOS, PCOD, PCO is all one and the same thing. This is a complex hormonal disorder which is a common cause for irregular and delayed periods, and it may be associated with facial hair, hormonal acne, scalp hair fall. So never ignore that. Then a very important gland, thyroid gland. So remember, your thyroid gland plays a key role in your metabolism, of course, and your reproductive hormone regulation. So conditions both like hypothyroidism and hyperthyroidism can affect your menstrual cycles. Even mild thyroid imbalances can lead to irregular, delayed, or skipped cycles. Then perimenopause. So years before the onset of actual menopause, the ovulation tends to be irregular, leading to missed periods. Then certain other hormonal dysfunctions like hyperlactin levels, adrenal reasons, anemia, certain drugs like use of hormonal birth control pills, progesterone, antidepressants, antipsychotics, corticosteroids, and chemotherapy given for cancers, all this can also disturb your periods. So, what to do in case you are missing periods? So, number one is do not panic. Remember, an occasional delay is common and often temporary. Second, track your cycle. Use an app or a calendar or write it down somewhere to monitor the patterns of your periods behavior. Then stabilize your routine. Make sure that you're sleeping regularly, you're eating balanced meals, you have a consistent daily schedule. Manage stress. Even small changes like regular walks, breaks can actually help to regulate your cycles. Get the proper investigations done. So, a late period or a missed period is not always a problem, but it is always a signal. Remember, your body is responding to something, whether it is stress, hormones, lifestyle, or some underlying medical condition. Hope you have already subscribed to Maitri. Please post your questions in the comment sections and I'll try and reply them. Until next time, take care and I'll see you soon.